Hi. Welcome back to my YouTube channel. Welcome back. My name is Not Go. I'm an assistant to my penultimate here in the University of Nigeria New Campus. Okay, so today we'll be talking about 5 tips to pass your OSCE exam in one sitting. Just master these things and you're good to go for your OSCE. Short, you don't even need to do much things for you to pass your OSCE. Everything about nursing is just to know the formula behind it and you're good to go. Follow who know road. So subscribe to this channel. Number one tip is cancel fear. It's an exam, they don't attract, they don't combine. You cannot be afraid of an exam and pass it. That one I can guarantee you. If you pass an exam that you wrote with fear, then it's magic or grace of God. Yeah, anyone you believe in, like purely grace of God. Cancel fear. Once you're going in for any exam, forget fear. Don't be afraid. It's just an exam. I'm going to pass it. Just keep on repeating it to yourself. Don't enter any exam with fear, because first of all, you will not be coordinated. You will be disorganized in the exam hall. You won't be able to gather your thoughts well and communicate properly the answer that they require of you. So it's very important that you don't go in for any exam with fear. Number two, read as if your life depends on it. If I may say, just read. Be versatile. Read everything about nothing that you can lay your hands on, because nothing Nigeria of Nigeria are kind of tilting back to ask questions that they don't used to ask before. So if you just base on past question what they used to ask, then you may not really do well. Because in our own exam they asked us about nebulizer, something that I've never seen any past question. They don't usually ask it, but they did ask it, and it's part of the procedure. So it's very important that you read as much practicals as you can. At least just have an idea, so that whenever they ask you a question, you'll be able to do so, even if you cannot get it perfectly well, as per you didn't really prepare very well for it, you'll be able to do something. Like for that nebulizer question, I don't know it, I've never done it, I've never even read about it, but I was able to do something because, hey, this is nothing. You must always do something, okay? You must always do something. And at the end, I saw the woman give me the score I got in that particular station was around 7.5 over 10 for something that I have never done or read. So it's very important that you just be versatile, read voraciously, read and read again. Number three is remember all the key things that you must do in every practical station. Remember all the key things. There are about 8 key things, so there are about that you must do in every practical station. You must greet your patient, you must provide privacy, you gather your instruments, you wash your hands, and then after everything, after doing the procedure, you discard your instruments, you document, you wash your hand, you make your patients comfortable, and then you wash your hands. These 8 things are like key things. So in every station that involves a patient, you know that if you're able to do these 8 things, you're going away with around 4 marks for each station. 4 marks in 6 stations is around 24 marks. 24 marks just by doing these 4 things, just by saying it, voicing it out. You don't even need to do them, just by voicing it out. Okay, I'm greeting my patient. Hello, Mr. Jones, how are you doing today? My name is Nurse Lisa. I'm going to be your nurse today. I want to do a vital step. Informed consent is another one, so that 9 of them. So if you're able to carry out these 9 things in each station, you know how many marks you're going off with. So it's important you don't miss it. You don't miss any of these things, so that you'll be able to do well in your OSCE exam. Number 4, do your projects well. They might not have told you this, but project has about 20 marks for your that will be added to your OSCE exam. So you know that for your exam, the main exam, you're battling with 80 marks. For your project is like 20 marks. So it's very important that you do your project very well. Council has a stipulated guideline. It has a guideline on how to write your project. And whenever they are marking based on the headings. Any heading you miss, you know you have missed that mark. For example, if you're supposed to write page 2 or thereabouts is acknowledgement, then after acknowledgement is dedication, after dedication, background study and all that. You will know that if you do not follow it in that step, in that reading, you are not getting those marks. If you're able to secure around 15 marks, 18 marks, 19 marks in your project, then you have already passed. By the time you secure 15 marks, add the 15 marks to the 24 marks that you will get if you do everything you're supposed to do in each station. you'll be having around 39 marks already. 39 marks. What else do you need to pass? 11 marks and you're good to go. 11 marks. Even if you are olodo, you'll be able to get 11 marks from every other thing you're doing. And then the viva has around 10 marks. So if you're able to get your viva well, greet your patients and all those kiri, all those minor things, and then do your project very well, there's absolutely no way you are failing your council exam. Absolutely no way. Now, I'm not telling you not to read your books so that you don't know your practical. Know your practical, so know them very well. But this exam, it's important that you pass. Know the important things. Know those tiny things that will make you pass your exam. Because last, if you are able to do your practicals very well in the hospital and you don't pass your exam, you will still not graduate. So know those things that will help you to pass your exam so that you pass and come out and be able to practice. Okay. Number 5, mind your business on your exam day. Don't look at your neighbor's work. You don't know if your neighbor is getting it right. Be confident in your own answer. Be confident in what you're doing. What if that your neighbor is doing rubbish? What if he's doing rubbish? During writing station, it's really hard to concentrate on what you are writing. That's the truth of the matter. A writing station has like 2 marks, 2.5 marks, sometimes 3 marks. So if you're able to gather it in each station, you'll be having around 15 marks at the end. The questions are usually very simple and based on what you did or is going to do in your next station or what you have done in your previous station. So it's very important that you focus on what you're writing. Write it very well, and then after writing, and be sure to write it fast. Write it fast so that you have a little bit of time to organize your thoughts before the next station. For instance, if you are in your writing station, then your next station is, say, hand washing, you'll be able to organize, okay, once I get there, this is what I'm going to do. First I'm going to do is read my question, and then I'll begin demonstrating hand washing. Okay, how do I wash my hand? First of all, I will wet my hands and then get soap and then lather it in my hand using friction. You organize it in that manner so that once you get to your practical station, you just do the exact thing you have already told yourself and you are good to go. So that don't waste your time looking at what you know, unless you don't know anything at all about the station you're going to, unless you don't know anything at all. But it's still very important that you organize your thoughts so that you don't go in front of your lecture examiner. You don't stand in front of your examiner confused, like, oh God, what am I going to do? What am I going to do? You become confused. So it's very important that during your writing station, write fast, and then sit down and organize your thoughts. The first thing you're going to do through to the last thing, if you have the time to organize it like that, and you see that once you get to that station, you'll be organized, you'll be focused, you do everything that you need to do. I see some people during when we write our own exam, some people get to that station, one station, and they just go blank. They don't know what to do. They just stand there, and then the lecturer will just be looking. The examiner will just be looking at them like, "Hello, what are you doing? Talk now." That kind of thing. So it's very important that how you are able to do it is by organizing your thoughts. When you are writing during your writing station, you organize your thoughts for the next station. Thank you so much for watching today's video. This is the last tip for today. And kindly subscribe to this channel. I make videos based around nursing, health, and lifestyle. Subscribe. Let's build this community together. Give me a thumbs up if you like this video, and comment if you have any question at all. Yeah, check out my other videos and share with your friends. See you in my next video. Bye.